Mario, a 39-year-old farmer, ingested massive amounts of organophosphate poisoning. This is how his organs failed. His life had been unraveling at the seams, and he made a decision that precipitated a dire emergency. The relentless failure of his crops and the deep emotional wound from his girlfriend's departure pushed him to the brink. In a moment of profound despair, he turned to chlorpyrifos, an organophosphate pesticide with notorious lethality, seeking an escape from his anguish. However, this act of desperation quickly spiraled into a critical fight for survival. As the poison took hold, the transformation in Mario was immediate and alarming. His once steady hands trembled uncontrollably, a visible testament to the toxin's rapid assault on his nervous system. Breaths that were once deep and rhythmic became short, desperate gasps, as if the air around him had thickened into an invisible barrier against life itself. His eyes, clouded with confusion and fear, scanned the horizon of his failing farm, a poignant backdrop to the unfolding tragedy. The turning point came when a neighbor, by sheer chance, witnessed Mario's plight. The gravity of the situation was instantly clear. Mario was in the throes of a life-threatening crisis, far beyond the help of lay interventions. The urgency in the hospital's emergency room was palpable as Mario was wheeled in. The medical team, recognizing the critical nature of his condition, upon arrival at the emergency room, Mario presented with the following symptoms. Mario was confused and disoriented. His neighbor, who rushed him to the ER, noticed his sudden change in behavior and mental clarity. Mario's mouth was frothing with saliva and she had difficulty swallowing. Mario's face and body were drenched in sweat despite the comfortable room temperature. His breathing was rapid and shallow, and she was gasping. It was evident that she was struggling to get enough air. Mario's pupils were constricted, appearing as tiny dots, and were unresponsive to light. His limbs displayed involuntary muscle twitching, adding to his distress. Mario's blood pressure was dangerously low, indicating his circulatory system was compromised. The ER team immediately recognized the signs of organophosphate poisoning and initiated rapid intervention. Mario was provided with supplemental oxygen to assist with his breathing, and his airway was secured to prevent further respiratory distress. Atropine was administered intravenously to counteract the excessive cholinergic stimulation and alleviate his symptoms. Doses were repeated to maintain his heart rate and improve respiratory function. Mario also received pralidoxime, 2-PAM, to reactivate acetylcholinesterase and counteract the toxic effects of organophosphates. Intravenous fluids were also administered to help support his blood pressure and maintain adequate perfusion to vital organs. Mario's vital signs, including his heart rate, blood pressure, and oxygen saturation, were continuously monitored to gauge his response to treatment. The cornerstone of the diagnostic process was the assessment of Mario's cholinesterase levels. These levels were alarmingly low, barely registering at 10% of the normal range. This critical finding was a clear indicator of organophosphate poisoning, confirming the medical team's suspicions and guiding their treatment approach. His liver function tests showed elevated ALT and AST levels exceeding normal values threefold. This was indicative of hepatocellular injury, likely a consequence of the toxic assault on his liver. The arterial blood gas analysis painted a picture of respiratory distress with hypoxemia and acidosis. This finding aligned with Mario's respiratory symptoms, underlining the need for immediate respiratory support. An electrolyte panel showed disturbances, particularly with elevated potassium levels, common in organophosphate poisoning due to the disruption of normal cellular function. Elevated creatinine and urea levels hinted at renal stress, possibly a result of dehydration and the direct toxic effects of chlorpyrifos on the kidneys. A chest X-ray was ordered to assess for pulmonary edema. At the same time, an electrocardiogram was conducted to monitor for any cardiac arrhythmias, both potential complications of organophosphate poisoning. Chlorpyrifos, an organophosphate, mercilessly inhibits acetylcholinesterase, causing an accumulation of acetylcholine. This leads to an uncontrolled firing of nerves, a storm wreaking havoc on the body. Mario was finally inundated with excessive cholinergic activity affecting his respiratory, cardiac, and neuromuscular systems. This poisonous assault manifested in symptoms ranging from constricted pupils and respiratory distress to cardiac irregularities. As Mario's battle against organophosphate poisoning intensified, his symptoms manifested in a harrowing array. Initially, he experienced severe respiratory distress marked by labored breathing and an ominous crackling sound in his lungs, indicative of developing pulmonary edema. Severe muscle weakness ensued, making even the slightest movements a Herculean task. His neuromuscular junctions were overwhelmed by the unrelenting storm of acetylcholine. Furthermore, Mario's cardiac health deteriorated rapidly. He developed arrhythmias, posing a constant threat to his life. These cardiac complications were a direct consequence of the disrupted autonomic control due to the organophosphate. The treatment of Mario's organophosphate poisoning was fraught with complexities. The medical team's initial success in stabilizing his cholinergic crisis was short-lived. Mario's condition was dire on the third day of his hospital stay. He experienced a sudden cardiac arrest. His heart stopped beating, plunging the emergency room into a state of high alert. The severe electrolyte imbalances and the direct cardiac effects of the organophosphate likely triggered this cardiac arrest. Resuscitation efforts were immediately initiated. The medical team performed cardiopulmonary resuscitation, CPR, and administered intravenous adrenaline, striving desperately to revive Mario's faltering heart. A weak but steady heartbeat was restored after tense moments that seemed to stretch indefinitely, a critical victory in the ongoing battle for Mario's life. However, the challenges did not end there. Post-resuscitation, Mario developed aspiration pneumonia, a complication arising from inhaling vomit during his initial presentation. This required aggressive antibiotic therapy and further complicated his respiratory management. Additionally, his renal function deteriorated, necessitating temporary hemodialysis. The organophosphate's insidious effects continued to ravage his body, necessitating a delicate balance of supportive care, vigilant monitoring, and timely interventions. Throughout this ordeal, Mario's prognosis remained uncertain. The medical team, equipped with expertise and determination, continued to navigate the tumultuous course of his condition. Each day brought new challenges, but also a renewed resolve to save Mario from the clutches of the deadly poison he had ingested. A critical moment came with Mario's asystole, a complete cessation of heart activity. Miraculously, resuscitation efforts revived him, a testament to the fragility and resilience of life. Mario's prolonged battle required advanced support, including intubation, mechanical ventilation, and a tracheostomy. His journey was a tightrope walk between life and death. After a grueling 60 days, Mario emerged victorious against the shadow of death. His recovery, though slow, was a beacon of hope and a testament to human resilience. Mario's harrowing experience sheds light on the devastating impact of despair, the complexities of organophosphate poisoning, and the profound capabilities of modern medicine. As an educational wrap-up, here's a concise summary of the mechanism of toxicity of organophosphates and carbamates, key diagnostic considerations, and a message of awareness. The mechanism of toxicity of organophosphates and carbamates primarily involves the inhibition of the enzyme acetylcholinesterase, which leads to the accumulation of excessive acetylcholine in the nervous system. Inhibition of acetylcholinesterase leads to the accumulation of acetylcholine in the synapses, resulting in continuous stimulation of cholinergic receptors. Clinical manifestations include muscarinic, nicotinic, and CNS effects. Excessive acetylcholine activation of muscarinic receptors causes symptoms such as vomiting, diarrhea, abdominal cramping, bronchospasm, meiosis, bradycardia, excessive salivation, and sweating. Overstimulation of nicotinic receptors can lead to muscle fasciculations, tremors, weakness, and respiratory muscle paralysis. Organophosphate poisoning can cause agitation, seizures, and coma. Some patients may develop proximal muscle weakness days after the acute cholinergic crisis, known as the intermediate syndrome. Diagnosis is based on the patient's history of exposure and characteristic muscarinic, nicotinic, and central nervous system manifestations. Laboratory evidence of poisoning can be obtained by measuring decreases in plasma pseudocholinesterase and red blood cell acetylcholinesterase activities. A 25% or greater depression in acetylcholinesterase activity from baseline indicates exposure. A comparison to a pre-exposure baseline measurement can help assess the extent of enzyme inhibition. Recovery of pseudocholinesterase activity usually occurs within weeks after exposure to organophosphates, while acetylcholinesterase recovery may take several months. Assays of blood, urine, gastric lavage fluid, and excrement for specific agents and their metabolites may provide evidence of exposure, but these tests are not widely available. Electrolytes, glucose, bun, creatinine, liver transaminases, arterial blood gases or oximetry, ECG monitoring, and chest x-rays may be necessary to assess and manage complications such as electrolyte imbalances, respiratory distress, and cardiac abnormalities. Early and aggressive treatment is vital in organophosphate poisoning, with a readiness to tackle its myriad complications. Understanding its toxicokinetic and pharmacodynamics is crucial for effective management. Awareness of the dangers of substances like chlorpyrifos and mental health support are key to preventing such tragic incidents. We invite you to reflect on Mario's story, share your thoughts, and discuss the importance of mental health and poison prevention. Subscribe for more insightful medical stories. Thanks for watching Medical Toxicology. Take care.